Planning on donating blood, but curious if it would affect your health? Or if certain conditions disqualify you from being a donor? Tag along as we invite you on a myth-busting trip, where we separate myths and facts, so when you donate blood the next time, you're saving yourself and others simultaneously. Whether you're a seasoned donor or contemplating your first donation, this video would help you know if donating blood might zap your superpowers or not. Number 1. Myth. Donating blood is risky and causes health problems. Fact. Donating blood is a safe process. The equipment used is sterile and disposable, ensuring there's no risk of contracting infections like HIV or hepatitis B or C. Donors are screened for eligibility, and the body replenishes the donated blood within a few weeks. So you're good to go until the hygiene is top-notch. Number 2. Myth. Donating blood is time-consuming and painful. Fact. The donation process usually takes about 10 to 15 minutes for the actual collection, and the entire process, including registration and refreshments, can take about an hour. It might cause a slight pinprick sensation, but it's generally painless. Number 3. Myth. I can't donate blood if I have a tattoo or piercing. Fact. Absolutely not. Having a tattoo or piercing doesn't automatically disqualify you from donating blood. Depending on the region and specific circumstances, there might be a deferral period before you can donate. Number 4. Myth. Donating blood frequently leads to a shortage in my body. Fact. The body regenerates the lost blood volume within a few hours to a few days after donation. Regular donors maintain healthy blood levels, and there's no long-term shortage caused by regular donations. Number 5. Myth. I can't donate blood if I'm on medications. Fact. In most cases, being on medication doesn't automatically disqualify you from donating blood. The eligibility depends on the type of medication, the underlying condition, and its effect on blood donation. Always consult with healthcare professionals or blood donation centers for specific guidance. Number 6. Myth. I can't donate blood if I have a common cold or flu. Fact. Having a mild illness like a cold or flu doesn't necessarily disqualify you from donating blood. As long as you're feeling well and healthy on the day of donation, it's usually acceptable to donate. Number 7. Myth. Donating blood leads to weight gain. Fact. Donating blood does not cause weight gain. The body quickly replenishes the lost plasma within a few hours, and the red blood cells are replaced within a few weeks. There's no impact on body weight due to blood donation. Number 8. Myth. Blood donation affects athletic performance negatively. Fact. Blood donation doesn't negatively impact athletic performance in the long term. While there might be a temporary decrease in stamina immediately after donation due to temporary loss of blood volume, it doesn't have a lasting effect on athletic abilities. Number 9. Myth. Donating blood weakens the immune system. Fact. Blood donation does not weaken the immune system. The body quickly replenishes the donated blood components, and regular blood donors typically maintain a healthy immune system. In fact, some studies suggest that blood donation may have positive effects on the immune system by reducing iron levels in the body. Number 10. Myth. Donating blood can lead to iron deficiency. Fact. While blood donation removes some iron from the body, it doesn't typically lead to iron deficiency in healthy donors. The body regulates iron levels, and the iron lost during donation stimulates the production of new red blood cells, which can actually help maintain healthy iron levels. Number 11. Myth. Older adults can't donate blood. Fact. Age alone doesn't disqualify someone from donating blood. Many older adults are in good health and can donate blood. The eligibility criteria are typically based on overall health rather than age. Number 12. Myth. You can't donate blood if you've had cancer. Fact. Having a history of cancer doesn't necessarily mean you can't donate blood. It often depends on the type of cancer, treatment, and duration of remission. In some cases, individuals with a history of cancer may be eligible to donate after a certain period of time. Number 13. Myth. People with diabetes cannot donate blood. Fact. Individuals with diabetes can often donate blood if their condition is well managed. It depends on various factors like overall health, medication usage, and whether there are complications related to diabetes. Consultation with healthcare providers or blood donation centers is necessary for specific guidance. Number 14. Myth: you can't donate blood if you've recently traveled internationally. Fact: traveling to certain regions might lead to temporary deferral from blood donation due to concerns about diseases like malaria or Zika. However, it varies depending on the country and region visited. There might be specific deferral periods before becoming eligible to donate again after travel. Number 15. Myth: donating blood is painful. Fact: again, this is a partial myth, as there is some pain as the needle goes in, but it is relatively mild and short-lived. Once the needle is in position, the donor should remain comfortable throughout. Following blood donation, there may be some pain at the site of the needle's entry. Some people experience bruising, but this is usually harmless and disappears in a matter of days. Thank you for watching. Hit the like button and let us know you enjoyed the video. And don't forget to subscribe to our channel for more informative videos.